For the month of March, Active Minds decided to focus on the book An Unquiet Mind by Redfield Jamison. In this book, she relates her experiences with bipolar disorder, both in the personal struggles that she's had with it and how it affected her professional career as a clinician. Bipolar disorder is marked by cycles of manic episodes and depressive episodes. In the video that I made for the book of February, I talked about depression and depressive episodes. A manic episode is a period of time in which a person feels highly euphoric or irritable. The person may have a sense of grandiosity and feelings like they can do things that are impossible, such as flying. They may engage in pleasurable activities to such an extent that these activities become self-destructive. People experiencing a manic episode tend to speak rapidly, as though their mind is generating so many thoughts that they can't express them quickly enough. And they may experience problems in functioning at work or school due to extreme distractibility. However, they also tend to pursue goals with great enthusiasm, accomplishing much in a short amount of time, often due to the fact that they require very little sleep to feel fully rested. To be classified as a manic episode, it must last at least 1 week, though episodes can last for much longer, sometimes even lasting weeks or months. People can also experience hypomanic episodes, which interfere less with daily functioning than manic episodes. Hypomanic episodes share a lot of the same symptoms as manic episodes, but tend to be less severe. This isn't always the case, however. Someone with hypomania can have symptoms just as intense as someone with mania, but is simply better at coping with them. To be classified as a hypomanic episode, it must last for at least 4 days. There are 3 types of mental illnesses that fall under the bipolar umbrella: Bipolar 1, Bipolar 2, and cyclothymic disorder. Bipolar 1 disorder is marked by 1 or more manic episodes with episodes of depression. This mental illness is often referred to as manic depression due to the cycling between manic episodes and depressive episodes. Bipolar 2 disorder is episodes of hypomania cycling with episodes of depression. Cyclothymic disorder, sometimes called cyclothymia, is marked by fluctuating symptoms of hypomania and depression for at least 2 years. People with this disorder don't have full-blown episodes of depression, mania, or hypomania. An estimated 4.4% of US adults experience bipolar disorder at some point in their lives. The age group with the highest prevalence of bipolar disorder is young adults aged 18 to 29 at 4.9%. An estimated 82.9% of people with bipolar disorder experience severe impairment due to the disorder. The good thing about bipolar disorder is that treatment for it is usually effective. The most common treatment for bipolar disorder is the use of lithium as a mood stabilizer. This is very effective. However, lithium can be highly toxic, so constant blood tests are required to make sure that levels aren't too high. Lithium can also have extreme side effects, which is one of the reasons why patients with bipolar disorder can be resistant to taking it. This can be especially frustrating to clinicians, as lithium can quite literally save their patients' lives. The National Center for Biotechnology Information reports that 20 to 60% of people with bipolar disorder attempt suicide at least once in their lifetime, and 4 to 19% of them succeed. Resistance to taking lithium was something that Jamison struggled with herself. Even as a clinician, she found herself feeling like she should be able to handle the disorder on her own, being averse to the serious side effects that came from taking lithium, and resistant to giving up the elevated moods that came with her manias. Despite the high moods, ability to quickly get things done, and ideas that came easily, Dr. Jamison also experienced many negative effects from her manic states, such as thoughts speeding by so quickly and so poorly formed she could barely think, restlessness that refused to go away even after sprinting around parking lots, and a few instances of traumatizing hallucinations. Accompanying the dangers of manias came dark and inescapable depressions. It was through worsening symptoms of both and finding a dose level that worked for her that Dr. Jamison was eventually able to make peace with taking lithium. In An Unquiet Mind, Dr. Jamison details her life as a child and the beginning stages of manic depression, her young adult life when the disorder really began to emerge, and her experiences entering into the professional world. She details her family relations, her romantic relationships, the positive and negative experiences she's had in telling people about her disorder, her fear of discrimination, especially in the workplace if people found out about her disorder, the pain of the man that she loved dying, and her worries about releasing the book and speaking openly about her struggles over the years. The book is witty, charming, heartbreaking, and so utterly candid in her experiences, thoughts, and feelings towards bipolar disorder, both from a personal sense and from a professional one. She strives to show manic depression in its entirety, both the positives and the negatives. She ends the book by stating that though living with bipolar disorder has been very difficult over her lifetime, if she could go back and choose whether or not to have it, she would choose to keep it, because it has been so fundamental to who she is and to the kind of person she became.